Of a CT brain of a 43 years old patient who had a road traffic accident. Please observe the diastasis of upper part of the coronal suture here, this one here. Now I will show you 3D. This is the fracture involving anterior part of left parietal bone. It is extending up to the scumoparietal suture here. Now this is the diastasis here. Now this diastasis extends across the midline onto left side as well. The fracture line again leaves the right limb of coronal suture to involve the anterior part of the right parietal bone as well. Please see the diastasis here, this one here. This is the right limb of the fracture here, line here. And this is the left limb of the fracture line here. Now I will show you his brain CT scan. Please see the hemorrhagic contusions involving posterior part of left frontal lobe, left temporal lobe and left parietal lobe. These are the ill-defined areas of mixed attenuation involving posterior part of left frontal lobe. Here, this one, most of the temporal lobe and parietal lobe. Hyperdense areas are noted inside it. These are suggestive of the hemorrhages. There is mild mass effect. Left lateral ventricle is narrowed. There is slight contralateral midline shift. So these are the hemorrhagic contusions. Now please observe hyperdense areas in the left sigmoid sinus. Jugular bulb is spared. These are the thrombi. On right side, no such finding is present. These are the thrombi in the left sigmoid sinus as well as the lateral part of the left transverse sinus. Let me show you the sagittal scan. These are the hyperdense areas suggestive of thrombi. This is the bone window. This is the fracture line here, this one. It lies just posterior to the left limb of coronal suture. It enters the coronal suture here, and there is diastasis. Please see the widening here. It crosses onto right side and then enters the anterior part of right parietal bone here. This is the coronal scan. Same findings of the hemorrhagic contusions.